Gousias. I wanted to show you a typical case of the ones that we see and treat here. This is a case where the patient has had gum recession and it has remained untreated for a number of years. That's why you see the significant notching and all the structural loss that has taken place on those roots. So these recessions have been going on for quite some time. They are getting worse over time. The roots appear to be darker, and that is because as the root wears out or wears down through exposure in the oral environment, we lose tooth structure and we get deeper and deeper in the root, closer to the nerve of the tooth, and that typically gets darker and darker. Um, Typically, what you see there is not only loss of structure from the root surface, but also loss of support from the tooth. Recession, irrespective or not, whether or not it causes any type of sensitivity, tends to be a progressive type of situation. So what we see here is untreated recession that went on for years, and most likely, if that's not treated now, 5, 10 years down the way, it's going to look even worse. Thankfully, today, we can utilize either the patient's own tissue or donor tissue or even synthetic materials in a very minimally invasive way that you see here. This is actually a day of surgery where you see the sutures. We can have a great outcome. 2 weeks later, we have new tissue. The tissue has responded really well. There's great healing. There's great tissue quality and tissue volume. And if we were to compare the before and after, there's a significant, considerable gain in volume and thickness and coverage. All these exposed root surfaces that were previously worn out and jeopardized and compromised are now completely covered. And because of the thickness and the health of the new tissue, chances are those areas will always remain covered. There won't be any progression in recession, especially if we alter some of the traumatic potential tooth brushing that the patient was performing. And thankfully, this patient is going to be able to keep their teeth and gums healthy for the rest of their life. So these are some of the. This is a typical case that we treat. Of course, I was hoping to catch this case even earlier without having that loss into structure, but thankfully, this is a great outcome, and this is the typical situation when we treat these cases. Thank you so much. Let me know if you have any questions, and I'll talk to you soon.